Good morning, everyone. Hello, hello. The community of Advanced Health. I'm so happy to see everyone here today, this morning, after a good break from Arab Health. And really so delighted to have all of you here in this new venue that we're trying for the first time. And I think we will be doing over the hot times, and definitely we'll go back to our old venue when the weather is nicer. This is our 26th Advanced Health session. I can't even believe it. So it's amazing that we've been doing this for the last 5 years. And this May actually marks our 5th anniversary of doing Advanced Health. So congratulations. And this really wouldn't have been possible without your contribution, your attendance, and your belief in what we're doing. This was an idea that myself, Thomas, and Marcus discussed some time back, and we believed in it. We started with a very small event, and look at it today, more than 100 people. So I'm very, very happy for this. Obviously, as you know, we keep on exploring different topics, different events, whatever is relevant, to the healthcare sector. And we have experts who contribute to this, and I'm very thankful to everyone who has done this so far. A lot of familiar faces in the room, so thank you again for coming. Today's Advanced Health Forum focuses on the very trendy topic of artificial intelligence, and I promised that we picked this topic before it was very trendy and everyone is talking about it. The rise of programs like ChatGPT has made people more aware of AI's power, use cases, and adaptability. I think the public knowledge of AI still remains to be very, very small, and there is a lot of doubt in people's mind, and people think, it's going to take over humans. So is this happening or not is something we're going to discuss in our panel. And obviously, we want this session to be as interactive as possible. So please do ask questions, good questions, please. With that, I don't want to take so much time. I know we started a little bit late, but we will start with our first speaker, Dr. Osama AbouElkhir, who is the CEO of Taki Health. And we will then hear from other speakers like Michele Tarnaw, Brian, Francesca, and Andrew Fawcett. Thank you very much.
Thanks, Marwan, for having me today, and thanks for Advanced Health for this very nice invitation. I was really also surprised by the gathering. MashaAllah, it's growing, actually. So congratulations for all of you guys, and all the best, inshallah, for this movement that you guys started 5 years ago. So just like quickly, I'm Osama, actually. I'm the CEO, co-founder of Taki Health. I used to be a medical doctor some time ago. Now I'm trying to get into a new domain. I will tell a little bit of my journey, actually, with the AI in Taki Health specifically, and in general, actually. So I'm going to take probably like 10 to 15 minutes max, promises. That's me with an AI avatar. I'm not sure if you guys have used that as well, but I'm actually using videos now to do, and instead of me, to do presentations as well, right? So I'm very lucky to have you, to be here physically today, right? So the idea that, so I will tell my journey while the projector gets to work. So as I said, I started my work actually as a doctor. I used to be a radiologist as well. So I used to work a lot on images, right? So I started in medical school. Like, I used to be a radiologist, so I was looking to images all the time. It got boring enough to get me to leave medicine, actually, and do something different, right? So looking to the images all the day, just like not the most exciting things to do, actually, for your life. So I jumped in different fields, and then I remember 2018 when deep learning was a thing, right? So back in the days, there were like a classic machine learning was performing very well. It was mainly based on statistic, right? Statistical learning, and then became deep learning, which came into play with the revolution on the image and what's neural network is, right? Or deep neural network. So I started like a little bit of exploring, right? Oh, okay, what's this field? Let's read about it. Let's learn about it. And day by day, I got more excited, right? And I got to learn also that Prof. Hinton, who's the godfather actually of AI, is a clinical psychologist, right? So it's like, okay, that's very interesting. That's a field in medicine, right? That's like studying brain basically, and it's disease related to brain. So it got me more excited, and then I got to know that the neural network was actually built on us as a human intelligence, right? So that's how your brain is functioning in layers of neurons synapsing together, doing around 100 trillion synapses actually in one human brain, right? It's fascinating that we're trying to resemble that in a lab. We're trying to assemble that in a machine. And then I got even more excited. So we got into the AI more and more. And we started Taki Health 2018. And I remember that day, it was in a lab actually in Area 2071, right? We were in the accelerator that was done the first time for AI startups, right? And I was sitting to one of my colleagues who's a PhD in machine learning. And we were training actually an X-ray model on VGG, which is a very deep neural network that's made out of 19 layers actually, right? And I got to see that it learns actually pattern, right? That I used to study and look to for years in hours, right? Overnight, and the next day we plugged the the X-rays with labels and all the stuff, like a couple of thousand for each disease, and then left the machine. Next day, it got to learn the pattern. So how does that happen? This is what the AI actually is working in reality, right? So just to imagine, what does neural network mean? So neural network is formed of layers, and each layer is learning a new thing and added to the next layer, right? So instead of just like 1 + 1 = 2, which is the statistical way of learning, this layer is learning something, a new pattern. For example, this pixel is actually working like 9. This is how the OCR works, right, today. So with 1,000, so each of us, if I gave you a paper now and you just write 8, for example, you will write it slightly different, right? So if I take a sample of all of you guys and get to the machine and said, look, all those 8s equal to the number 8, the machine will pick the pattern for people who are not here in this room, right? So the millions of people who are not here, I can generalize the model and get it to learn a new 8 that has never been seen before. Through what? Building internal connections between those layers, right? I got to see also kind of capabilities that the AI can do. And with all the hype, if you remember, maybe a year ago, there was like, let's talk about the new reality of being in the metaverse, for example, which I believe that those ideas are really good, right? But the AI stick around, and it has been in the field for the past 30 years, right? It's not a new field, by the way. It became trendy, as Marwan said, maybe because of ChatGPT, but it was in research and academia actually for a long time before it became mainstream. So the AI today can see, right? It can understand videos as well. It can interpret videos. It can interpret temperature. And it can also learn things out of few examples. So instead of telling the machine what to do, the machine will learn that and come back to you, say, does that make sense for you, Mr. Human? And I would say, okay, or not, which is another field, very interesting field of AI, which is reinforcement learning. So a lot of, the reinforcement here means that I got, for example, Google team has got the Atari game, which is a complex game, to learn from reinforcement learning. Just let the machine play and it figure out how to play right and how to play wrong on its own, right? So, um, and I think, honestly, the moment is now, which is great, because now the world has seen the capability of the AI, right? So if you go now to ChatGPT, which became a mainstream, the fastest mainstream application on the planet ever, even more viral than the social media, which was made to be viral and made to consume your time and brain and energy as well. So it came mainstream because of the capability and the power behind it, right? So large language model, which is the like GPT-4, has been trained on trillions of like transformers. It's a transformer based, actually. It was invented by Google, by the way, not Microsoft, not OpenAI. But the use actually of that in reality became more powerful than what we have ever seen from a language model, at least on a public domain, right? And I think now, in the past, what, 3 months, 4 months, 6 months, right? Maybe okay, that's exciting because business is going well for Tech Health, which is good, alhamdulillah, because we are an AI company as well. But again, there is a huge interest actually in the topic, and it's getting more attention. So my following slides will talk about how I can do that in my organization. And here I'm just hypothesizing that you might be working in a hospital, or you might be working in a pharmacy, or might be even working with an insurance company, right? That's the idea here. I'll try to make it interesting as much as possible. No promises on that, but I will try my best. So why you need a roadmap, right? So as anything, right, guys, just not being able to plan is a failure from the beginning, right? So AI, I believe it's a journey, not a destination. It's not something I will do, I will succeed and then move on to the next. No, it's not like that. It's actually a culture. I believe it's a culture that needs to set in the organization and have a lot of weight behind it to succeed. That's why I'm seeing it. It's a learning journey, right? It's not a destination, and it became more specialized more and more. So I think having an AI would give you a roadmap, AI roadmap for your organization, would give you that. I will have clear goals, timeline, what I want to achieve actually out of that. I will align stakeholders as well. So, you know, the IT team, the clinical team, the management team, they need to speak together a language of AI, right? Also, I think having some risk mitigation, maybe we'll discuss that later on, but like, for example, the data exposure, the data quality, and failure of the AI projects, which is something can happen as well, right? And also, I think having resources in place so the people get excited. And I think a lot of people now are excited, which is good. So now it's the momentum, guys, to seize. And I think finally you need to have a clear path actually for what you are doing. I think the first and most critical step is to define what am I going, define your what, right? So while talking to executive all the time, and I said in different organizations, because I usually work with the hospital as well as insurance. So they need to think and come up with their kind of what they really want to do, right, with the AI, and define their what quite well. There are plethora actually of researches, papers, and even articles that you can read. But I like this chart, which is I'm not referencing it here, sorry, but it was talking about like if you are pharma, health system, or on the individual health or a population health, what areas you can touch on with an AI. So AI today is working on the prevention, actually. It works on the prevention. I'm just trying, work on the prevention area by identifying risk factors, also in the diagnosis. Can someone tell me any diagnosis-related AI use case from the audience? Breast cancer. Who said breast cancer? Yes. Thank you. Excellent. That's excellent one. What else? Someone said. Okay. What's that? All image processing, right? So my boring X job. right? So any image can be actually diagnosed, or I would say augmented by the AI. And I think AI in the loop is something very fascinating actually in the AI domain, in the healthcare domain specifically because of regulation, right? We'll talk about that later on. But for example, if you're in a hospital and you're sitting, your job as well to document all the day. Who's doctor here, guys? Is there any doctors here? Okay. Okay. How much time you spend on your documentation per day? Like all your day? So on average, it's actually 6 hours per 10 day, 10 hours, right? 50 to 60% of your time is actually documenting, right? And we lost actually the human touch in medicine as well, which is another thing. So if you go now to a clinic, you'll find the doctor sitting at a desk, right? And there is like a laptop or a computer in front of him, and the patient is there, and he's not looking to the patient anymore. It's just my laptop, right? So it's just like that's what we get with an IT systems. And unfortunately, I think the IT systems impact on the healthcare was not that fascinating, but let's leave it to other time. So I think the clinical decision support system will make your life easier. So and instead of documenting everything, the AI can at least do a little bit of documentation for you. And I've seen amazing things that has been done with language model today, that you can just give them a few lines and then it can write for you a full discharge summary, which you would probably do for 1 or 2 hours. So yes, I'm not advising to do that, guys, but just like those are things that they will be reality very soon in healthcare. Are we going to replace doctors? I'm not sure. I don't think so. But it will be AI in the loop as a must for all the organizations, including the most sophisticated hospitals. Again, you can work on the medical record systems. You can predict, for example, missing cases for tomorrow, waiting lists for tomorrow, things like that. I can expect, for example, how many nurses I need in 3 days from today, actually, by a predictive AI model. So I think the use cases are exciting, and there are a lot, but I will come back to something very important as well. After defining the what, you need to think about the data, right? So without data, there is no AI, just as simple and plain as that. Without a good data, and again, maybe without a good quality data that is correctly labeled, the AI will suffer, the AI team will suffer a lot. So whenever I go and talk to my team actually in the company Taki Health and say, okay, they say, well, what data do you have? And then let's talk, right? So whatever use case that you have, it doesn't matter if you don't have the right data for that. And in healthcare, we're blessed. Actually, 30% of the world data is in the healthcare. So we have a lot of data to work on, right? So you have images, you have text, you have tabular data, you have voice data as well. Are you doing dictation as well, doctors here? Right? And the doctor is always talking, right, to the patients as well. So if you have an AI that listen and transcribe, it might make your life easier, might let the patient life easier as well. You have also a lot of mixed data. So most of the insurance as well as hospitals, they have all those kind of data somewhere in different formats and different ways. However, think a lot about the data quality, standardization, and what you have as well in data, in the privacy as well. So, you know, a lot of the gaps that we have seen in the medical documentation because of the data sensitivity, right? So in the middle of the chart, and that's something that we faced a lot. So when you go and train on a medical record, you'll find that the patient name is there. And then in the second line, the patient name again is there. And then third line, his birthday is there. So you need to desensitize the data before going and doing any training on them as well. So think about that. And luckily, there are models that they can desensitize now the information. So they take out birth dates, they take out names, and they just leave you with the clinical documentation that's not sensitized anymore or sensitive anymore. And I think number 3 is to define your metric, right? Now I defined my what, and I look to the data, and I know it's good, actually in good shape at least. I need to define also the benefits and KPIs. So, okay, what is your burning platform? We used to say that in like consulting. I have a couple of consulting colleagues here, right? So why I want actually to do that? So usually I will always link it to the dashboard that you have. So clinical, financial, or operational, and think about areas that you want really to improve, or think about it in a more structured way like this, right? So there is, that's like a very simple voting mechanism. So probably the team will come up with a lot of excitement, a lot of ideas, and a lot of metrics as well to work on. However, it's very important actually to prioritize as well. Priority here, as simple as how difficult it is. Is it something that I can do, or I can work with someone, or it's very hard to achieve, right? And the other one is the benefit, how much I'm gonna get actually out of that. That's a chart that I use always actually in discussing with healthcare executives. And we always need to come up with the most priority, the easiest one to do, and the highest impact on the organization. And probably stakeholders are really interested in that part as well. So for example, here I can talk about, for example, deciding on the ICD-10 CM code, helping doctors to do that. Let's define tomorrow's cancellation rate, for example, identify suspicious medical claims, and then I'm gonna plug them all here and then agree on the highest priority, and that's what I will take to implementation. Let's talk now about the how, right? So there are two big things, right? Either you do it yourself, kind of people, who is do it myself kind of people. So you go to the home and you fix your own things, right? So there are maybe, I see some IT directors here as well. They believe in maybe doing it myself big times, right? And they want to engineer everything, which is absolutely fine as an approach. But the other approach is to work with someone, partner with someone, startup, company, whoever. I'm not trying to promote Taki Health here, but you can talk to us as well. But let's say you can talk to someone, but I will start with do it myself. A typical mistake, and I've seen that happening over time, is that you think about the AI as an IT project. Failure from day one. It's not an IT, right? It's not an IT project. And it shouldn't be under the IT director unless you want this to fail, right? What we believe is that AI is a new discipline, a new domain, right? It's a very different science than engineering. In Taki Health, we have two different, I would say, functions, right? So we have a head of AI and we have chief technology. Those guys are working together, but they are under different kind of mindset. It's the kind of kitchen versus serving. So the kitchen is the people who are doing all, who likes actually to cook here, right? So you do a lot of recipes, a lot of experimentation, and hopefully most of them will be good, but you will have failures as well during the process. And then there are people who are presenting that, right, to the end user. So think about it like this. So the AI team need to be in the kitchen. They need to have way to fail, right? So if their research, the data, they have an issue, or the research, or the algorithm, or the outcome, or the monitor, or the deployment, all of that can fail, actually. It's a long journey, by the way. So you need to give them a way, empower them with a way that they need to work as not the typical IT project implementation where you have a defined scope from day one, and you know what is the requirement, and you know what's, no, it's not, doesn't work. And I think also you need to gain quick wins. And I have seen that. So you need to have, there is usually excitement in the beginning. Oh, we're going to deploy AI. Great, let's go and do it. And then after a couple of months, what happens with your AI project? It's still work in progress. Really? We said it will happen like 3 months ago. Where is the result? Right? So it's important to, that's why I'm thinking about priority very well here. So think about something that's easier, even if it's not the most impactful, that's fine. If you find a use case that's gaining both, that's fine. For me, get with the easier one. Because for example, booking cancellation, predict booking cancellation, that's something that you can do in a week. So I can predict what's gonna happen next week, actually from a few machine learning, even not deep learning algorithms, right? So that's on that side. On the other side, I think also AI is becoming a specialty on its own. And my colleague here, George, keeps saying I'm a doctor and machine learning, but I don't believe in that much. But really, it's in the machine learning itself, there are people now who are working on the image. They don't work on other text format. They don't go and work on a video. So it became like a subspecialty as well, right? So you can be generalist. Maybe I'm a generalist, actually. But there are specialized people in each domain now. And when you talk to them about something different, okay, you know what? I need to go and learn it because it became like a specialty or subspecialty. So if you think about text or image or tabular data, you need to think about like those companies that they are excellent at. And I think it's a journey, not a destination, as I said in the beginning. So you need to start with a proof of concept, POC, proof of value as well. So you need to assess the impact and make sure that it happens. I have seen some IT directors here. Have you started IT, Ali Asghar, right? Have you started in any AI project actually in your organization? Did you start with a POC? So do you advise actually to do always a POC in the beginning? Big bang doesn't work that much. Even, by the way, in the typical software, going full blown, I will implement all the use cases of AI in my organization, that doesn't work, right? It will cause frustrations as well. So POCs here are very important for the organization to learn, adapt, and also for the new team or the new company to also engage with you in better audience and work from there. Usually, the POC can be a very good gateway as well to define the success criteria, the metrics that we talked about earlier, or revisit them. So usually, for example, we promise accuracy of 95%. Can you actually achieve that during the POC, right? You promise, for example, detectability by 100% or 99%. There is nothing like 100%, right? Because it's probability. It cannot go 100%. So it's like 90%, no, 99%. So did you really achieve that target during the POC? Or you need another iteration? And be very, very careful that over judgment of an AI, you're setting it to failure. So as I said, it's like a journey, not a destination. So, okay, I achieved 88 and my target was 95. Fine, you can actually fine tune the model, play with it, add the new data, play with the, for example, the matrix or whatever the name, the technical jargon is you're using, and then you're moving to the next. I think once that happened, the trust is built, then you need to go to expanded AI adoption, where you can go to further use cases. If you're involved in, for example, clinical, you can also go to the financial, you can also go to the operational, you can go to a wider. And maybe this is the right time to hire a head of AI in an organization or a chief data scientist. And again, this is not the typical IT person, to be very clear. The last thing is actually about the, let's say, the ethical consideration while you work on AI. So as any, all of you guys know, healthcare is heavily regulated as an industry. We have, you name it, GDPR, HIPAA, compliance in UAE, compliance laws in Saudi, compliance laws everywhere, right? So you need to follow that, think about it a lot while you're working on the data. And also desensitization is something very critical. Encryption of the data as well while you're sharing it, especially if you're doing it externally. So there is like cloud usually actually most of the AI systems are not very tough to be deployed on the prem. They are easily to deploy in the cloud because of the capability. There is a GPU or TPU attached to that machine. To do that physically, it's very tough. So usually you're going to exchange data back and forth, right? So you need to be also think about the encryption, also putting a governance actually in place. So who's going to take care of that, let's say, implementation from a governance point of view, as well as implementation. And last thing, I think AI is a living baby in your organization. So you keep an eye on that baby from time to time, right? If you just lose the I would say the monitoring of that in AI, it might just go crazy sometimes, right? Maybe some of you have tested a crazy AI use cases, right? And I think that was the last thing. So thank you really for having me, and I hope that it was helpful for everyone. Thank you. Thanks.
Good morning. I'm Michele Tarnaw from Alliance Care Technologies. As I was thinking about this speech or this presentation, I was thinking about a lot of us have been in AI for a long, long time. I can date myself back to we filed our first patents in 1998 on AI, and their usability is just coming to term. But I also wanted to bring it really close to home. As I was starting to think about building a company here in the UAE, which was much less fragmented than the United States, I met probably a lot of you in this meeting. This is the Dubai Healthcare Investment Meeting in October of 2019. And we were talking about a lot of really cool things, a little bit scary, like the fact that in 2030 we would have a shortage of physicians and healthcare providers across the board globally of about 20%, 18 million. Little did we know COVID would blow that number out of the water. We were also talking about really exciting things about in the UAE, we have vision, and we're going to create the world's best health systems. And we were looking at what are the best practices around the world. And of course, we had a list. Who in healthcare does not have a list that doesn't have prevention at the top? It has been at the top since Hippocrates. It's still there today. And so out of all of this, all of us during the coffee breaks were abuzz about all of the AI that was going to come, and then COVID came. And while for most people, COVID was really scary, for all of us in AI, we were, yes, we are at the top of the world. The consolation prize of COVID is going to be crossing that digital transformation chasm. Didn't quite come, did it? In reality, we enabled telehealth, which then everybody said, oh, okay, we're here. AI is here. No. People, telehealth is not AI. Never will be. We have a lot of things in store that will revolutionize healthcare, and we will get there. But we're not quite there. We are at the station, still waiting for the healthcare industry to belly up the tracks for us. But have no fear. ChatGPT, I think, has really made some stark changes for us. And so while we have everything invented, we've had them on our roadmaps, some of us longer than others, we have a lot we can roll out for adoption. That's not to say that we're not frantically updating things to incorporate generative AI, but the use cases that Dr. Osama talked about, the who, the why, the how, all of that is still there. We can just enhance that. We can also, thanks to the cloud, we can reduce a lot of our costs. So our value-based healthcare story is even better. So I'm going to take you back. So Dr. Osama talked to you about how he was using images. This is where I started my journey at Kodak, long before you had tagging. So this is where geotagging, facial tagging came from in all of your social media apps. My team was working on distinguishing between muffins and chihuahuas, zebras and fences, elephants and haystacks, and you can all see where that has taken you in your daily lives. Where we're going to go with this next, which is really exciting, is in Africa, we are going to leapfrog EMRs. Imagine we are going to start with the individual having their data centered around them, not a brick and mortar building that they go to, not a pharmacy down the street. It is going to be based on them. Also, with facial recognition, we can now also start to predict disease states. We can get vital signs from them. There's a lot of exciting things we're incorporating. And then, Tom somewhere here in the room. I stole this from your website. We are taking natural language. Synapse Medical, for any of you who don't know, takes contextual semantic understanding and translates that into any medical code. We use this on a daily basis under the hood of our solutions. It is also reducing costs for coding medical documents, as well as reducing the lag for reimbursement for physicians, both from a timing perspective, but also, more importantly, from an accuracy perspective. Internet of Things. I don't know what the installed base is today, but in 2018, 1.2 billion people were wearing a Fitbit-like device. And more AI is coming out of this. There is AI everywhere around us that is healthcare based. Dr. Osama talked about how much medical data there is. This is indirect medical data that we can use for health and well-being. We can predict risk of injury. We can also help people live in place longer by having remote monitoring, and they don't have to wear this dumb button around their neck that causes all kinds of false positives. And we can do remote patient monitoring. We can measure, are they compliant or not? Rather than the patient coming in and being asked by the doctor, did you do your physiotherapy? Oh, yes, doctor, I did. But I really still don't have my range of motion. Sure. Now we know, and we create gamification out of it so they are compliant. And they're enjoying it, their outcomes are better, their reliance on pain medication is reduced, and their overall health and well-being improves. I won't spend much time on this slide since this is Dr. Osama's field, but the FDA has now approved that AI can be used in the diagnosis of breast cancer. So for many of you who may not know, it requires 2 radiologists to sign off on a diagnosis. Now we only need 1. Are we eliminating radiologists? No, because we don't have them. We cannot train our way out of this problem. This is helping people get diagnosed faster, treated faster, and cured faster. We can use retinal eye screening for predictive measures, not only in eye diseases, but cardiovascular disease, risk of stroke, and diabetes. Digital pathology, which is so near and dear to my heart, please come to Dubai quickly, is changing the way pathologists work. Rather than spending 5 to 6 hours doing Ki-67 cell counts to determine the degree and existence of breast cancer, it happens before you can blink an eye. We are using it to prevent pandemics and epidemics in the future through symptom-based early pathogen detection and automatic pushing out to hospitals and health agencies around the world. And here's the most exciting thing, I think. Well, almost. We'll have one more slide. So this is a solution that takes the sequenced information from a tumor biopsy, and it identifies the best cancer therapeutic treatment for the patient. What is super exciting beyond the fact that we're going to get people precision medicine in cancer treatment, this is the first augmented CPT code awarded by the American AMA. It was awarded in January. It is 0794T, remember that number, and it was incubated at the Dubai Future Foundation. And lastly, we can bring together research networks from around the world to bring physicians together to work, providing them all the AI they need on a single platform so they can collaborate by replicating digital twinning, if you will, the data into new instances to move faster in discoveries of biomarkers, pharma discoveries. The world is really ready, but we're not quite there. The train is in the station, we're waiting for the tracks, and all of us together, collaborative. One of the best things is we no longer have silos. That's a great thing from AI, but it's working together to build those cases that Dr. Osama was talking about of value, of both value from a perspective of patient outcomes as well as efficiency. So again, I'm Michele Tarnaw. This is our ecosystem of AI. Some of it we started a really, really long time ago, but the time is now. And I'm going to introduce next Brian Francesca, who probably doesn't need much of an introduction. I can't imagine anyone in this room hasn't met him, but Brian is now taking the helm as Group CEO at Thumbe. Of course, he has a very long history at many hospitals, largely at Johns Hopkins, where he really started launching the modern expansion of medical centers here in the region. So thank you very much.
What am I going to say? Thank you so much, Michele. And also after her presentation, she covered it all between Dr. Osama and Michele. I'd like to introduce Andrew Fawcett, who's the next. No, seriously, it's great to be here. I'm just going to have in about 10 minutes just cover a few of my thoughts and observations with you. Look, since we all know right now that ChatGPT is here, the Terminator is going to come, it's going to wipe us all out. So I thought I'd just put a nice big smiley face up. Yep, now you're all smiling, and the end is near. Sorry about that. But I promise to return from the future again, as I have now, to sort it out. So continue flossing and get your sleep. Where are we now? Both of the excellent previous speakers touched on it. We're in what is called the in-between. It is the period in between when a technology becomes real and viable and when it is actually in broad scale use. This is what I just said, so I didn't want you to have to read all that. An example. 1879, Thomas Edison gave us the light bulb. That was followed by 45 years of relative darkness. The light bulb was real. The light bulb worked, and no one used it because of the things that Michele touched on about the chasm and adopters and systems needing to be in place. However, the pace of technology adoption since the light bulb, as we all know, has increased rapidly, exponentially. Electricity took about 45 years to be relatively ubiquitous. The telephone, 35 years, radio, 30 years, you know the rest. PC, 15 years, smartphones, it seems all of our kids have 2 of them and they can't get off of them. And then most recently, we saw Google Translate, everything to Telegram, Spotify, ChatGPT. My wife, Nadine, is always correcting me about that. I get the T's and the P's. Now, I got more about you later on. Don't worry. Yeah, Joe, I do. Overnight, it was 5 days. It went from 0 to 1 million. Right. So when we're talking about adoptions, everything from electricity taking 45 years to GPT being almost mainstream overnight. Is it real? Is it now? Is it ready? Are the patients actually okay with it? It appears they prefer it. I don't know if you can see the part down the bottom, and that's got my real punchy quote. I wanted to move the chairs. AI, this was a broad study in Taiwan predicting pancreatic cancer better than radiologists. Hard science, right? Not maybe, if, when. Real now, hard science. The quote at the bottom that you probably can't say is from an ex-colleague of mine. I think these findings are game-changing, says Linda Chi-Hang Chu, professor of radiology at Johns Hopkins University. We're not even questioning it anymore. Dr. Osama mentioned Jeff Hinton. In the late 50s, early 60s, he is the person from University of Toronto that coined the term artificial intelligence. And in 2016, Jeff said, stop training radiologists. You know, I'm not worried about the current doctors. You're not going to get, by the time we adopt everything, you're all fine. I'm worried about the men and women that are in medical school. They're going to graduate without jobs. And it's not just radiologists. It's almost everything. Pathologists, dosimetry planners, so many areas. So what this is telling us is we need to give a serious rethink to all aspects of medical education, and not in 30 years, right now. You know, we have the Gulf Medical University, the largest private medical school in the region. We are actively now rethinking who do we teach, what and how and where. Why are we still training radiologists? You know, years ago we knew, stop it, but we're still doing it. Possibly. One of the reasons is healthcare historically has been a technology laggard. You know, for good reasons, right? You know, we've got people's lives and all, so there are good reasons, but there are also systemic reasons, bottlenecks. So the bottlenecks for AI, first of all, is, does it work? Is it real? Yeah, it's working. It's proven. It's real. Actually, it's been proven and working for over a decade. As you know, Michele was like, you know, what's the Israeli one? Zebra Technologies out of Israel. They were filing U.S. patents 20 years ago. But for some reason, the U.S. FDA wasn't approving them. Maybe it was because there's 33,000 radiologists in the U.S. who make $500,000 a year and belong to the American Medical Association, one of the biggest lobbies in the U.S. Maybe. I don't know. Don't want to be a cynic. So industry, we're there. The light bulb is here. The regulators, we need to partner with the regulators and support them. If they are going to regulate these things, they're going to need a bunch of data scientists. They're going to need a bunch of AI specialists, all these people that, well, they don't have. So we're going to need to collaborate. Industry is going to need to collaborate to share our resources with them so that this can all move forward. The payers, they're not going to reimburse for anything unless it's approved by the regulators. Right? And then the providers. The providers are not going to use anything unless it gets reimbursed for, and it's not going to be reimbursed for unless it's approved by the regulators. So we need to get everybody in the same room. The patients, a lot of them seem really ready to go. So what's in the way for the providers? You know, as Michele mentioned, I started a new position on May 1st with Thumbay for my organization, but for all organizations. Why are we so slow, and why do we often fail? I've been lecturing on AI in medicine for 15 years now, something like that. And in the early years, it was all about neural networks and language models and, you know, all the stuff that you've all heard about so often. And I'd be talking about that. And then I realized that that's not the problem, or that it's the fact that it's about a digital transformation. Okay, we're going from analog systems, making paper, so, and you've all heard about these, all from your EHRs or EMRs, all these digital transformations. Most of them fail. When I give my lecture on that used to be AI in healthcare, now it's been all about digital transformations. This is my first slide. My very first slide is failure is normal. Because if we don't see that reality and acknowledge it, we're not going to do anything about it. So all this wonderful AI stuff, if Dr. Osama comes out to your organization, he has great stuff. Michele has great stuff. But if I am so disorganized when it comes to my whole digital journey, I'm not going to be able to use it. no matter how wonderful it is. It's not about the technology. You know, when I've done a ex-MBA program on digitalization and all that, you know, and I ask all of these hospital people every single time, when there's AI, when there's a new whatever it is, who's responsible for it in your organization? Every single time, the IT guy. Right? Right? With all respects to the IT guys in the room and gals, you know, yes, you're important, et cetera, et cetera, et cetera. It is a pan-organizational, massive change management initiative. And most of our organizations are horrible at that. We don't even have specific departments and individuals responsible for project management, process management, change management. Does anyone in the room have human beings responsible for change management, process management, and project management? I'm going to grill you later on because I don't believe you. Okay. Okay, I'm serious. I'm going to hunt you down. Yeah, so think about it. And this every large group in the region